what about PCOS? Like, what is your approach? Because that's all I've seen it in younger women, and it
Yes.
it does end up affecting their fertility because in conventional medicine, the treatment is to put you on birth control, but then you can't get pregnant. So like how do you, what are your thoughts on like a woman who has PCOS and has been on birth control and now wants to, get pregnant?
Yeah. So PCOS, unfortunately, I feel like a lot of patients that are living with that are dealt a bad hand. They are told
Yeah,
almost always birth control is your only option, and they are
yeah,
started on it from a very young age. So I see a lot of women that have been on it since they were 14, 15 years old.
yeah,
And at the same time, nobody's addressing the other health conditions that oftentimes come along with PCOS. So I think there's
correct.
a lot of misinformation out there. I think there's a lot of junk diagnoses of PCOS as well. I am
Okay.
oftentimes finding people that are diagnosed with PCOS that maybe don't actually have it, or maybe they did
Yeah.
at one time and then things transition. So, there's a couple things that are crucial for me. The first is that there are different subtypes of PCOS, meaning that
Okay.
you don't have to have all the criteria in order to have PCOS. And the second
Okay.
thing that I think is most important for your listeners to know is that just because you have cysts on your ovaries does not mean you have PCOS. Now it
Yes.
might, but that is not
Yeah.
diagnostic of PCOS. So if you go to the emergency room and they tell you you have cysts on your ovaries, you have PCOS, that is not accurate. Okay.
Okay.
There's additional evaluation that needs to be done.
Yeah.
There's other criteria we look at. So the two other criteria are signs or symptoms of elevated androgen levels. So testosterone is high, or if you have facial hair growth, jawline acne, some of those male dominant patterns. And then the
Yeah.
third criteria we look at is signs that you're not ovulating. So for some women, that can be very irregular periods. For some, that means that they just don't see those ovulation markers. And so you need to have two out of those three criteria in order to be diagnosed with PCOS. The second level then that we do is that if you are truly diagnosed with PCOS, we want to start looking at what are the other underlying features that come along with that. So
Yeah.
very, very commonly we find that women with PCOS have problems with their blood sugar or with their insulin
Yes.
levels. It's that
Yes.
metabolic piece you mentioned,
Yes.
but not always, right? So sometimes I see women come in, they have PCOS. They were told you need to go on a medicine to lower your blood sugar. And I asked, well, did they check your blood sugar? And so they said, no. I said, well, then what are we doing? Right. So not all PCOS has metabolic resistance. A lot of it
Absolutely.
does, but it also is the key to treatment in many cases. And so in my world, if a woman
Yes.
comes in with PCOS, she's coming off birth control because she wants to get pregnant. That's the number one thing that we check is we're looking to see, are there other metabolic disturbances going on? Do
Yeah.
you have insulin resistance? Because oftentimes, if we start to treat that insulin resistance, we start to see ovulation will come back. And then when ovulation is coming back, then a natural pregnancy can occur, right? And so
Correct.
that is very, very common to see that when we're treating the underlying actual root cause
Yeah.
of this PCOS, the rest of it stabilizes. And then from there, it's a matter of if they're not still ovulating, okay, what are we going to do to help encourage that? Again, whether it's timed medications, whether it's working on other lifestyle pieces. But again, our first focus is improve the health of the individual we're treating, because then the
Yes.
menstrual cycles will resume naturally and then pregnancy is more likely to occur naturally. And so I really love working with women with PCOS who are dealing with fertility concerns, because so often these women are told, okay, go on birth control. And then when you want to get pregnant, go on IVF. And then when you don't want to get pregnant again, go back on birth control. And they're on hormones their entire life and
Entire
things are a
life.
mess.
Yeah.
Yeah. And then nobody's addressing the elephant in the room of what about her overall health, right? And they become diabetic,
Exactly.
all these other complications with pregnancy. It's like, no, no, no. Fix the health problems and the rest falls into place.
Thank you for that. And you are definitely preaching to the choir because I really think that like it becomes such a mess. And then, they are on birth control, IVF, we are not dealing with the high insulin or the consequent diabetes, or then
Yeah.
they end up on, metformin or insulin, insulin
Yes.
shots to get to. So we are just looking at, okay, now you have an A1C of 6. Okay, now you go on metformin. Oh,
Right.
the metformin isn't working. Okay, now we are adding glimepiride, or
Yeah.
now we are adding insulin. So
Insulin. Yeah.
then I really believe in root cause
Yes.
focus.